sometimes we have a little technical difficulties. We had some technical difficulties earlier. They are now gone. Welcome, everybody. Glad you're here. Welcome on a Monday. This is the first Monday in August. It's August already. What? Are you crazy? Wowee. I cannot believe it. I would, yeah. July is gone. That was a long month. And now, but August comes up so quick. But anyway, it's been warm. It's been balmy. My shrubs are out of control. Thank you, Angie. My shrubs are out of control. And alas on the lawn, I can't get out to cut them because I'll die of heat stroke. Hugs to Angie. All right, kids. This is Sunrise Santa Rosa. My name is Nick Stewart. You know what your name is. Telephone number to call is 850-771-0049. We got a forecast for you. Hot and wet. Isolated thunderstorms this morning, then mainly cloudy during the afternoon with thunderstorms likely, high near 90. Chance of rain 70%. Locally heavy rainfall possible. Oh, joy. Then tonight, thunderstorms, low near 73, chance of rain 70%. And tomorrow, scattered thunderstorms in the morning, becoming more widespread in the afternoon, and a high near 85. Chance of rain tomorrow, 90%. What I wouldn't give for a good old-fashioned drought. It's 79 in Milton, 83 Gulf Breeze, 82 Navarre, and 78 in Pensacola. A drought would be nice at this point. All right, kids, glad you're here today. I got to show you something. The mugs are here. All right, so we'll give you an understanding and a know-how to get one of those mugs. And my Angie. And so you got a bunch of them. I need them to go. They came Saturday in several great big boxes. So I need to get rid of them. So I'm glad you're here. Thankful rain and cooler temps. The cooler temps, okay. All right. But the rain, we are so oversaturated right now. I just want to tell you, if there's nothing out there at the moment. There's nothing in the Gulf at all. But if we did happen to get something, the trees in these areas would be gone. Every tree would come down because the ground's so saturated. Woohoo. About the mugs? I hope that's about them. Yeah. It says Risers Unite. And it has Sunrise Santa Rosa with Nick Stewart. And then on the back, it says hashtag stay strong. So there you go. You got to get one. You got to get your mug. All right. We'll give some away. We will. I promise. The Olympics are looking for the next, well, not the Olympics. The Wheaties are looking for their next box cover from the Olympics. And I've got a suggested. There you go. This is what should be the Wheaties box for this year. All these people I will tell you, Sharon, how to get a mug. I promise. But the snowflakes and how many people they're canceling because of the stupidity. But I think that this should be the new Wheaties box. What are your thoughts? I think this tells the story of the 2021 Olympics. Go, Wheaties, go. Oh, my gosh. I just can't take it. I cannot. All right. We'll get to the COVID nonsense shortly. So if you're paying attention to the county commissioners, to the race, Ray Eddington of Navarre has registered as a candidate for the 2022 county commission race. Dave Peach currently occupies that seat, and that's about it. He's occupying the seat. He's taking a check and sitting in the seat. He has not yet pre-filed for re-election. But Ray Eddington, don't know Ray, but you do have an option. Oh, this is weird. Oh, thank you, Donna. Snowflakes is on the Wheaties box. Yep. Natasha. Oh, Natasha's gonna run for Dave Peach's spot. I absolutely love it. I love it. That's very nice, Natasha. Yeah. Let us help you with your platform. Let us help you. It'd be so much fun. All right. So this happened. The county rejected Adams Sanitation to serve the South End. Oh my gosh. The county commissioners rejected Adams Sanitation permit to serve the South End. Now, they're appealing the decision and plan on starting service October 1st in Santa Rosa County anyway, in South Santa Rosa County. They will be starting service to Greater Gulf Breeze and Navarre on the 1st of October. Can you believe? Now, Adams believes that they're going to reverse it. They got it on appeal. They feel that the commissioners will do the right thing and reverse it. Why would they reject it? Why would they reject it? Seems odd, does it not? Oh, no, we can't have an option. Yeah. Does it make you concerned? Does this concern you at all? If you support the commission, the county commission, if you support Peach and Cole and Wright, do you really think that this is on the up and up, that they have rejected this? No. Yeah. Adams has more faith in his BOCC doing the right thing than I do. I would submit yes. But this is interesting. This is very, very interesting. We will watch this, that they rejected Adams Sanitation for whatever reason. Yeah. Watch this story. Oh my gosh. All right. So let's get to the COVID stuff. So my buddy Andrew McKay from News Radio, worked with him, got my start in talk with him, and appreciate Andrew. But he posted Saturday or yesterday in an email to students on Sunday. Pensacola State College President Ed Meadows rescinded the prior announcement requiring universal masking on campus indoors starting today. Now masks are only recommended, especially for the unvaccinated. Now, here's the other part. Only people who have been vaccinated or cannot be vaccinated due to medical reasons will be excused from absences related to COVID-19. So if you have been unvaccinated, if you're not vaccinated, you will not get an excused absence for COVID. That's only reserved for the vaccinated. Now, here is what you've got to understand. The current vaccine for COVID doesn't cover the Delta variant. It doesn't cover the Delta variant. But if you've been vaccinated, you get a pass for COVID sickness. So I want you to understand this. They are now at Pensacola State College admitting that the vaccine doesn't work. They're admitting the vaccine doesn't work. Yeah. Otherism. It's against HIPAA to reveal medical records. And Denise, yes. Now, I had a lady call me, a viewer call me last week on Friday. And just ranting. It didn't make any sense on most of it. But what she was saying was that it's not against HIPAA. It's not against HIPAA. How's that against HIPAA? I said, because you don't have to reveal it's for the public safety. So HIPAA only applies if it's for public safety. Now, Natasha, who's he? No pronouns. No pronoun rule. So it is. Now you could say, because she said, what if someone in the school class gets COVID? So you got to tell whether you're vaccinated or unvaccinated. No, you don't. If someone in the class gets COVID, yeah, you have to say someone in the class has COVID and do contact tracing, but you don't tell who it is. So ridiculous, so dumb. I know common sense, it should be out. You can't use common sense with COVID because that defeats the purpose. Just say it. There's a massive 300% hike in nationwide COVID-19 deaths recorded Friday by Johns Hopkins University. It was skewed by states dumping data. In one case, dated back as far as last spring, according to a report. The university, which has been a trusted source of coronavirus information since the start of the pandemic, reported that U.S. deaths surged from 321 on Thursday to 891 on Friday, as the Delta variant quickly spreads through much of the country. Florida was responsible for a huge chunk of the increase, with 409 as of Friday's death toll coming from that state. However, Florida only releases weekly data on Friday, making the day-to-day totals reported by the university unclear and overblown. Figures released by Delaware also added to the surging daily increase, as that state announced 130 new deaths on Friday. The dramatic figure was misleading because those deaths actually occurred between May 2020 and late last month. May 2020. Again, these numbers are unreliable. Absolutely unreliable. And we've said that all along. I do want to share this. Let me pop this picture up here. Now, I want you to look at this very carefully. Now, the green line is cases in hundreds on a 7-day moving average. The red line is the deaths, including dumps. The number of cases approaching the level seen in previous surges, the 7-day average of daily cases has risen as high as 66,000, close to the peak of 662 set during the summer of 2020. Yet hospitalizations have been much lower. Daily hospitalizations so far have hit 31,148 at the highest, far below the 54,488 hospitalizations, for instance, in the spring surge of 2020. Likewise, daily deaths so far have reached a high of 296, only about a tenth of the peak during the winter. Those aged 65 and older have the highest risk of being hospitalized with severe COVID-19 or dying from the disease, as it's always been. But nearly 80% in that age group have been fully vaccinated. Most of the people who would have died in previous surges are largely vaccinated now, said Susan Hassig, an epidemiology professor at Tulane University. Those contracting COVID-19 tend to be younger. Reports from Florida, one of the epicenters of the current surge, show that the average age of those hospitalized is in the mid-40s. People under age 50 are likely to be hospitalized or die from COVID. They're also less likely to be vaccinated, and the vast majority of those presently hospitalized are unvaccinated. So what? So these people are not going to die from it. They're less likely to die from it. I want to see this again. Hold on. How many of those deaths are from COVID versus with COVID? You can't ask that question, Jeff. And how many of those deaths, and we'll get to that in a minute, are from people who have been vaccinated? How does COVID test tell whether you have the Delta variant or not? That's a great question, Joanne. It is divisive. And yeah, you're correct. Now, we're going to get to this because I think this is vitally important because you need to see this. Officials with the city of El Paso, Texas, confirmed that 7 fully vaccinated people have died of COVID, meaning they got 2 jabs, fully vaccinated. Health officials on Wednesday said during a meeting that all 7 people had underlying health conditions, as it's always been. As it's always been. A male in his 50s, a female in her 50s, a male in his 60s, 2 females in their 60s, a male in his 70s, a male in his 90s. Health officials said they did not have information which vaccines were administered to those 7 people. I bet you they do. They aren't sharing. Elizabeth, I'm afraid you're correct. How many doctors are saying COVID was the main cause of death and not the actual cause? Well, they're having problems now because people are dying that have had the vaccine. More than a dozen high-risk Missouri residents who were vaccinated against COVID-19 were among those who died amid a surge of cases that's led the University of Missouri to reinstate a mask mandate and some St. Louis restaurants to permit only the immunized to eat indoors. High-risk, immune-compromised, and sadly couldn't muster an immune response, tweeted Steve Edwards, president and CEO of Cox Health, in announcing Thursday that there have been 6 COVID-19 pneumonia deaths among vaccinated patients at its hospitals in southwest Missouri. Additionally, 8 fully vaccinated Mercy Springfield patients have died since June 1st. That amounts to 12% of the 68 total deaths at that hospital during that time. They all had other serious health conditions, she wrote, adding that 7 of the patients were over age 75 and 1 was over age 65. COVID vaccines greatly reduce the chance of severe illness and death. How is that? You tell me how that worked for these folks. Anybody? And remain effective against the variants. It doesn't. I call bull crap. How can people with that are getting the vaccine are still getting the Delta variant? Why? They have to wear masks. Why is it, if it's effective against the Delta variant, it is not effective against the Delta variant? Get that through your head. Like many other vaccines, they are less effective in people with weakened immune systems and frail elderly. Now, that's always been the case with COVID and the flu. If you have an underlying health condition or you are elderly or a combination of both, guess what? It's a dangerous thing. That's what it's always been. Get that through your head. There's no proof that the vaccine is effective against Delta. Money for anything related to COVID. So most hospitals will list as, yes, absolutely. But now they're torn because this one's been vaccinated and they got it and died. Yeah. We call it as we see it, Corey. Now, again, the lady that called me on Friday, and she was using real vague generalities, and she said, why don't you provide both sides, Nick? I said, what do you mean? And she said that you just say people shouldn't get the shot. I said, I didn't say that. I didn't say that at all. I said, if you want the shot, get the shot. But if you don't want it, you shouldn't have to get it. All power, yes, force it. I'm going to get to that. I'm getting to all that. Your remedial comment. So listen. If you decide to get the COVID vaccine, understand you're not protected against the Delta variant. The regular COVID has passed. You're not hearing, there's no regular COVID anymore. It's the Delta variant, or so they're saying. Maybe, put your foil hat on, my friends. Think about this. Because the test, the COVID test, can't tell you that it's a Delta variant. So what if this is just a COVID surge and they're calling it Delta so that you think you're vaccinated? So people get the vaccine, get the vaccine. Why? Why? If it doesn't protect against the Delta. But they want it, it'll be better. It's better if you get the vaccine. Maybe it's not doing what they say it's going to do. Maybe this is just the COVID. And the vaccine is not effective. What if it's just the flu? Well, there's that. Delta variant means people aren't scared anymore. Yes. Yep, you got to keep that fear going. So what's the next variant? Gamma. Meaning to show deaths caused by vaccines. Oh, yeah. Per the CDC, the Delta is the same. It affects younger people. Okay. WHO setting this thing up for yes, they don't want. Yes, the holidays are coming. You can't be happy. I want to show you this. Where's Fauci? Fauci disagrees with you. Of course he does. This is he on This Week yesterday, talking about why he disagrees with you about wearing masks.
Ask you about the reaction we've seen from prominent Republican governors. We've seen Florida Republican Governor DeSantis, Republican Governor Abbott of Texas, Governor Ducey in Arizona push back strongly against the notion of mask requirements. Let me read you a quote from Governor Ducey in Arizona. He said, Arizona does not allow mask mandates, vaccine passports, or discrimination in schools based on who is or isn't vaccinated. They are arguing that this is individual responsibility and an individual's right to decide. What is your answer to these are Republican governors in some of the largest states in our country?
Republican governors, it's their fault.
Well, John, I disagree with them. I respectfully disagree with them. The fact is, there are things that are individual responsibilities that one has, and there are things that have to do with you individually, which also impact others. And get the spread of infection that we're seeing now, the surge in cases, John, is impacting everyone in the country. So although you want to respect a person's individual right, when you're dealing with a public health situation, and we are in fact in a very serious public health challenge here with a pandemic, with a virus
that you caused, that you caused. You gave money and helped fund this nonsense.
Extraordinary capability of spreading rapidly and efficiently from person to person. So a person's individual decision to not wear a mask not only impacts them, because if they get infected, even though they say it's my decision, if I get infected, I'll worry about that. But the fact is, if you get infected, even if you are without symptoms, you very well may infect another person who may be vulnerable, who may get seriously ill. So in essence, you are encroaching on their individual rights because you're making them vulnerable. So you could argue that situation both ways. So you could argue that.
Well, maybe they should get vaccinated, but it's not going to help them. You got me? It's not going to help them. I don't know if doctors are giving this to people. Oh, are you talking about ivermectin? Is that what you're talking about? I don't know what I'm talking about. This. I don't know what this is. I know. I got you. I am being responsible to me, Dr. Fauci. My doctor has stopped asking me about it. She just said, "Do you have all the vaccines you want?" I said, "I do." And that's it. That's it. Okay. That's what I thought. I just want to make sure. Yeah, I've got that somewhere. He said masks don't work, and then he changed it. He said that a couple different times. Yeah. Pants on fire. Flaming breeches. Oh my gosh. Governor DeSantis ramped up his rhetorical offensive against the Centers for Disease Control and Prevention on the same day Florida set a record for COVID-19 diagnosis because they released a whole week at one time. Keep that in mind. Governor's already banned mask mandates in Florida schools, meaning the school districts cannot require them, but they can be one if somebody wants to. Nonetheless, on Saturday night, he blasted the federal government. During a Fox hit on Unfiltered with Dan Bongino, DeSantis suggested the CDC would want to mask students indefinitely, adding that schools were perfect for mask optional policies. One of the dangers I feel with having mandatory masks at this point, I think a lot of those bureaucratic authorities are going to say, hey, we mask for COVID. Flu is more dangerous for kids than COVID. Maybe they need to mask kids every flu season. And then it just never ends. And he's right. He's right. Tell one lie to cover another lie, Natasha says. Yep. My friend, Stephanie says, my friend's son, wife, and 8-month-old baby tested positive. The doctor said for them to get the jab in 90 days. So ridiculous. The vaccinated aren't protected. And yes, here is, I will say this. This is my guess. That if you haven't had it, if you've not had COVID, you will be more cautious about germs and that kind of thing than you are than people that get it. Because people that get it go, I'm safe, and they're not, because the shot doesn't do that. The source cause is the only way to keep from happening. Who knows why this was even created in the Wuhan lab? It's for control. That's why it happened. Some are giving prescriptions. Some hospitals are giving it as part of a treatment protocol. Ooh. Come on, Sharon. What? Giving what? You're that. There's no object to that. Pinpoint, people. Focus. An interoffice memo sent to Leon County, Florida employees Wednesday. The county set forth a plan that said all employees have until October 1st to be vaccinated or will be terminated. As an employer, we're required to provide a safe environment for employees, and unvaccinated employees pose a significant risk to spread the virus. What virus? The Delta variant? Virtually virtual reality park helps people in Big Ben. The mandate comes as vaccinations stagnate, and the Delta variant has created a resurgence of the COVID-19 virus, with the state of Florida at its epicenter. No, that's not true. The state of Florida is not at the epicenter. So dumb. The COVID vaccination rules apply to new and existing employees, and the only exception to the mandate are for employees who are unable to be vaccinated due to an ADA-covered disability. It prevents an employee from receiving such a vaccination, a sincerely held religious belief. To be exempt from the mandate, qualified employees must fill out an accommodation request form and submit it to Leon County Human Resources on or before August 16th. Employees who are granted accommodation to this condition of employment will be required to wear a mask at all times while at work. In addition, the county may opt to require unvaccinated employees submit to a negative COVID test on a weekly basis. There you go. There you go. COVID is a bioweapon, lots of political uses. Yes. Hey, Jeremy. I'm great, man. Depraved minds coming to life before us. Yes. Thought it was illegal to require someone to get a vaccine. No. But wait. That's a great question, Donna. I'm glad you asked it. God bless you. I want to show you this. This is Joe Biden. And he was asked by a reporter about masks. And this is what he said.
Should Americans expect more guidelines coming out, more restrictions because of COVID?
In all probability,
Should Americans expect more restrictions with masks due to COVID?
yesterday, almost 1 million people got vaccinated. About 500,000 of those people for the first time or a second shot. And so I'm hopeful.
And now, let me ask you a question. So he said, in all probability, you're going to have to wear a mask again. He's going to do a mask mandate thing and going to be wearing a mask. Now, he goes, good news yesterday, 1 million people got vaccinated. Really? How do you know that? How do you know that? I think that's a line. He said, in all probability, you will be wearing masks again on a regular basis. That's what they want. Wondering what would happen if all employees mentioned decided to walk away from the job because they don't want the jab. Well, let me tell you something. Rose, that's a great question. Because if you are the county, it's Leon County, and those who are not vaccinated go, you know what? I'm done. And walk out, which they can get a job down the street. There's lots of jobs available. Everywhere's hiring. You can get a job literally anywhere. And the county doesn't get business done because people said, you know what? I don't need this. I don't need this. And walks out. What happens? Yeah, there needs to be, no mandates at all. I don't care if you're a private company. You can't mandate that people get a jab. That's the way it should be. Oh, man. But you have to wear a mask until that point. Yeah, and if you are granted an accommodation that you medically can't or religiously can't, you'll have to wear a mask all the time. All the time. Who pays for the lawsuits for side effects of the jab? Well, I don't know. They're probably protected against that. Congressman Clay Higgins of Louisiana introduced yesterday the Employee Rights and Freedom Act, which would make it illegal for any employer to mandate an employee undertake any medical procedure, including a vaccine. And that's the way it should be. No mandating any kind of medical procedure. What? Dr. Rochelle Walensky, the director for the CDC, was forced to issue a correction late Friday after an interview on Fox News in which she admitted the Biden administration is exploring the possibility of a nationwide vaccine mandate. While speaking with Fox News' Brett Baer on Special Report, Walensky admitted that she and President Joe Biden are looking into a federal vaccine mandate. Baer asked, are you looking for mandating a vaccine on a federal level? That's something that I think the administration is looking into. It's something that I think we're looking to see approval from the vaccine. Overall, I think in general, I'm all for more vaccination, but I have nothing further to say on that except that we are looking into those policies. Now, her comments came as the Biden administration aggressively pushes for Americans to receive the vaccine. After the interview, Walensky claimed on Twitter that she was not, in fact, referring to a nationwide mandate for all Americans, but for certain federal workers and private institutions. Let's look at the quote again. Are you for mandating a vaccine on a federal level? That's something I think the administration is looking into. It's something that I think we're looking to see approval of from the vaccine. That's pretty clear. To clarify, she says, there'll be no nationwide mandate. I was referring to mandates by private institutions and portions of the federal government. There will be no federal mandate, she claimed. Oh, walk it back. Walk it back. Walk it back. Holy smokes. Who posted that? Oh, Renee. There's no way I can get to that at the moment. None. Send me an email, sunrisesantarosa@gmail.com. sunrisesantarosa@gmail.com. Thank you. Yeah, no worries. No worries. It is long. It would take I need to digest that. So send it to me an email. The number of cases, no, I saw that. I did that one. Okay. So there you go. But we understand that the Delta variant is not covered by the vaccine. If it is in fact a Delta variant, because they can't tell. How do they tell? They can't tell it's a Delta variant. You go and get the COVID test. It's COVID. It's COVID. So is it, well, the shot doesn't cover the Delta, but does give you greater protection. People are still dying from it. People are still dying from it. Listen, if this is the Delta variant, the number of people that are dying has dropped tremendously. Now, let me say this. Every life is important. The woman that called me Friday, I keep going back to this because it just irritates me. And I was pleasant to her. I just challenged her on some thoughts. But this is so ridiculous. She said something about everybody should get the vaccine. I'm like, why? And she said, well, they to protect people. I'm like, if you're scared, because people are still getting it. Those that are being vaccinated are still getting the COVID. I said, yes, exactly. And she said, well, if you're scared, stay home. If you're scared, stay home. And she said, well, that's terrible. Why is it terrible? You don't want to make me fear to stay home. If you're afraid, stay home. If you're not, go out. You got the shot, go out. Knock yourself out. If COVID was never isolated to start with, how was a test created? Ooh. I'm liking the way you're thinking, Christina. Mm-hmm. Oh, this is interesting. I just, on this whole thing, I don't have a problem. If you want the shot, get the shot. Knock yourself out. If you don't want it, don't get it. Take zinc. Take your vitamins. Stay healthy, just like flu season. Just like flu season. When I asked last week what the total number of deaths was, I laughed at WEAR on Facebook. Their post was of rising positives locally. Yeah. That's the thing. Now, I want you to see this. If you died from a head wound before, it was COVID. Now, if people have the vaccine and they're dying, they're hiding it. They're hiding it. Or if people died because of the vaccine, they're not saying, well, you see what I'm saying? It's all hinky. Do you think vaccinated will ever have to get a booster shot? Oh, yes, absolutely. A third shot. They're already talking about it. Most people's immune system is low due to overusing. There's no falsehoods at all. I mean, you're right. If you use hand sanitizer, you don't get any natural germs. Yeah, you're correct, Denise. There's a shortage of why have there? Yeah, there was. Well, I asked that question to the lady that called me on Friday. She goes, well, people were wearing masks. I said, the masks don't work. They already said the masks don't work. It's virtue signaling. You're right, Katie. Exactly right. So dumb. So dumb. There's a shortage of ammunition in the U.S. By the way, Gulf Coast Guns, they have no shortage of ammunition. I was there Saturday at their event. Thank you to Gulf Coast Guns for sponsoring a program. God bless them. There was no shortage of ammunition at Gulf Coast Guns. Awesome. But there's a shortage of ammunition in the U.S. It's having an impact on law enforcement agencies. People seeking personal protection, recreational shooters, and hunters, and it also could deny new gun owners the practice they need to handle their weapons safely. Manufacturers say they're producing as much ammunition as they can, but many gun store shelves across the country are empty. Let me ask a question. What happened? Remember back during the Obama administration when they were buying up hordes of ammunition? Does anybody remember that? Does anybody remember when the Obama administration was buying up hordes and hordes of ammunition? Where's that, I wonder? Makes you curious, don't it? Oh, yeah. It's just too bad you can't send ammo through the mail. Yes. Well, Gulf Coast Guns has great prices. Great prices. Former President Donald Trump has not yet announced whether he'll run for president in 2024, but hasn't stopped his campaign from bringing a massive fundraising haul. Trump is armed with a whopping $102 million in his war chest heading into the 2022 midterm and the 2024 general election. That's according to the federal finance filings. Trump's political committees ranked 82 million during the first half of 2021 and have 102 million in the bank. Trump, who's been expelled from all of the major social media platforms, raised nearly as much as the Democrats and Republicans in the first 6 months of 2021. According to federal election records, the Democratic National Committee raised $87.1 million in the first half of 2021, as reported by Open Secrets, a self-described nonpartisan, independent, and non-profit research group that tracks money in the U.S. politics. The Republican National Committee reported raising $85 million from January 1st to June 30th. Trump is smoking it. What does that tell you, my friends? It's pretty amazing. Very, very interesting that all this is working in Trump's favor. By the way, I read this, that Kamala Harris is the least popular vice president in history. The least popular vice president in history. 46 and 47% disapproval rate. They hate her. They hate her. Oh, she's a strong woman. No, she's an idiot. Yeah. Least popular in history. Walmart has a shortage of change too. Oh, yeah. Yes, they are trying to digitize your cash. It is a thing. Kamala who? Yeah. Oh, this will encourage you today. The Menstrual Equality Act of 2021. Yeah, you heard right. The Menstrual Equality Act. It would require all public schools serving students in grades 6 to 12, the California State University, and each California community college and public agencies to maintain restroom facilities for the public and for employees to stock at least 50% of restrooms with feminine hygiene products at all times, and request the Regents of University of California to private higher education institutions to do the same. Now, California recognizes that access to menstrual products is a basic human right. It's vital for ensuring health, dignity, and full participation of all Californians in public life. The bill states inadequate menstrual support is associated with both health and psychological issues, particularly among low-income people. A lack of access to menstrual products can cause emotional distress, physical infection, and disease. Now, yes, Jason, wait, listen to this. The bill makes it known that menstrual products are not only for females, but also for biological males. Maron. California has an interest in promoting gender equality, not only for women and girls, but also for transgender men, non-binary, and gender non-conforming people who may also menstruate. They may experience inequalities resulting from lack of access to menstrual products. Are you kidding me? What in the name of all that's holy? What have we come to? We have to provide menstrual products to people who don't menstruate, but think they do. They think they do. When will this nonsense stop? Joanne, it stops when we tell them to stop it. Common sense has gone out the window. Absolutely the dumbest people. The Democrats are the dumbest people ever. They're idiots. The Democrats are absolute morons. How does a biological male need? Well, because they associate with females and therefore, yeah. Oh, yeah. If they ever had minds to begin with. No, you don't have to make it up. That's how dumb it is. That's absolutely how dumb it is. Quick, get some more chicken blood. Yeah, but you're right, Katie. You've got to stop voter fraud. It must stop now. Yeah. Distraction. Maybe. One of the targets, largest troves of non-biodegradable trash getting in our water bodies. Yeah. But you've got this. Because they identify as a female, non-biological males get menstrual products. Now, let me ask this. What about females that identify as biological males. They should not get it. That's a waste of money. If you're a biological female that identifies as a male, you should not get access to free feminine products. If you're going to do the biological males that identify as females, they get it. But if you're a biological female that identifies as male, you should not get it. Yes? Oh, wait. Nick applied logic again. You can't do that. You can't do that. Yeah. Masks. Oof. So a guy thinks a gal, so he puts on pads once a month. Or, well, we don't want to go there. It is great. I love that picture, Stephen. That's a great picture. I don't know what program you're using, but it's awesome. So, common sense has gone out the window. When you've got biological males, where it is impossible for a biological male to menstruate. Impossible. If I was a feminist, I would be screaming. Where are the feminists? Where are the feminists screaming about this? You're not a female. You can't identify with our plight. Now, Jason. I'm walking away. Monthly identity crisis. Keep everyone confused and distracted from the primary issues of controlling everything. They're catering to the mentally ill. If you are transgender, that is a mental illness. That is a mental illness. And you are endorsing their mental illness. It is beyond ridiculous, Breon. You were correct. It does. It does require mental evaluation. But this is where we're at. These are the kind of people that we're dealing with. And look, the Democrats are promoting it. The Democrats introduced this bill in California. That's not a Republican thing. That's a Democrat thing. We're going to pander to the mentally ill. Instead of getting them help, we're going to enable them. Come on. Come on, people. You are correct. It is the end of times. Read your Bible. Unholy becomes holy, and holy. Yep. Yes. Good is evil, and evil is good. No. I mean, no, they don't. They are playing off of it. They are using it. They are using the mentally ill, and that ought to be exposed. But nobody wants to call transgenderism mental illness, but it is. It is. Yep. You are all correct on this. So this is what you need to see. It is the Democrats' job to do every outlandish thing. Look, they called for defunding the police. No, they said the Republicans did. No. We have it on record. You called for it. Now, all the Democratic mayors that endorsed it, defunding the police, are now calling for more police because it's a combat zone. All this nonsense that they're doing is just ridiculous. They are now trying to walk back the cancel culture, but you've already opened that thing. Can I identify as a guy today and go topless? As long as you don't post on Facebook. California is a sinking ship. We ought to just take a saw and cut it off and let it drift into the ocean. Yes. Liberalism is a mental disorder. Progressivism is a mental disorder. Watch yourselves. Watch yourselves. And look, this whole vaccine thing, now that if COVID is gone, this is Delta variant, so the shot does not protect against the Delta variant. Well, it does. It lessens the severity. Those that are getting sick are those with compromised systems where they have underlying health conditions or elderly. That's what it's always been. That's what it's always been. And they're trying to keep that fear going. They're trying to turn up and change truth. Well, you're not necessarily male. You're what you think you are today. And they are just changing the truth. And you are the victim. You are the victim. Oh, the vaccinated are the Delta variant. But again, how are they testing for the Delta variant, Christina? I don't know. That's a good question. We have no way to know. We ought to get a petition for the rest of the United States. The rest of the United States ought to get a petition and vote California off the island. Survivor. Let's get rid of him. That'd be great. Okay. Renee says, why are there not biohazard containers everywhere for use masks? Interesting. Why is it called Delta? Because this is the fourth variant. And that's the way it works. All right. Be watching for how to get your Sunrise Santa Rosa mug. And hashtag stay strong. And we'll be announcing that pretty soon. So you can kind of pick them up and get them. And we'll have all the details. But I'll be giving some away. So just keep that in mind. All right. Thank you for joining us today on this Monday, August the 2nd. Woohoo. Great times. Thank you to Gulf Coast Guns for sponsoring us and show them some love. All right. They had a huge crowd Saturday out there at the swap meet. Go to gulfcoastgun.com and check them out. And we will see you tomorrow for Tuesday if the government doesn't shut me down because of all the COVID stuff. I will talk to you later. God bless. Stay strong.